and welcome. I am here today at the International Headache Society's annual congress in Seoul, Korea, and I'm joined by my favorite researcher, Dr. Raquel Gil Gouveia. Dr. Raquel, I have been a big fan of your work. I've always seen your name on research papers, and I'm very happy to join you today on this beautiful day in Korea to talk about you and to get to know you better and to help our listeners and viewers understand more about your journey and what you have been doing. Welcome.
Thank you, Heba, and this is too much of a nicer introduction for me and my work, but thank you for the opportunity to be here with you.
So, can you tell us a little bit about yourself? Where are you? What are you doing?
Yeah, my name is Raquel Gil Gouveia. I'm Portuguese. I work in Lisbon, so I'm a medical doctor. So I trained as a neurologist in the biggest university hospital in Lisboa. That's Santa Maria Hospital and the Lisbon University. And I trained with Professor Isabel Pavão Martins,
Yes.
which is already also very well known in the headache field. And that's kind of why I came into headache, because she is a very active researcher. And as soon as I met her, actually in med school, still well before our specialty, I started working on headache projects with her.
So were you in your undergraduate medical school, and that's when you met her?
Yeah.
And we find a lot of the people in headache were inspired by
Mentors,
and mentors that they. Do you feel that this is something that is still happening with the next generation, or was it this generation that has generated this?
I think mentors are something that are very important in medicine in general. So we, at least in my country, but I see that internationally, we also see that. So people that inspire us and serve as role models and supporters and help us out are very relevant. And so if you have the good fortune of meeting one of such people as I did, I think you'll be fruitful in your experiences as a clinician and as a researcher.
So this got you into headache, but then how did you end up doing research? Like what took you from getting interested in headache to researching in headache?
Well, if you analyze my research interests, there were much clinical research questions. So I do clinical research. I have an experience in basic research, of course, because it's part of learning, but it's not actually my thing. I like patients, I like clinics, so I do clinics every day. And this is the main focus of my research. And the purpose is to understand headache and how to help patients in a more efficient way. And this is all my path has been around this, clinical problems and clinical issues and clinical research. Of course, then you have trials also a part of clinical research, and I have a great trial activity, as most of researchers do, but I do focus a lot on clinical research and practical everyday problems. And that's why cognition is one of my research areas.
That was my next question, because your name is a big name in cognition and migraine. And as a practitioner working with patients, I'm always asked, like, I'm more at risk of a stroke? Will I lose my cognition? Will I get brain fog? These are all questions that we get when we work with people living with migraine or with patients, and we don't know if we have the answer. Most of the time, I really think I have the answer, but I don't know if my answer is right. What do you think of cognition and migraine?
Well, to get the big picture, I think there are two main aspects. One is the cognition changes that happen during the attacks. And these are mostly reversible. Okay, this is part of the attack. And we now understand that migraine is a brain disorder. So there are still a lot of information missing on how does this happen in the brain process of migraine itself. Is this only pain-related? Is it specific for migraine? And these are all answers that I hope I can contribute to. But I think it's clear that during the attack, all phases of the attack, cognitive symptoms do occur, cognitive dysfunction does occur, and this disturbs patients' functioning on top of pain and nausea and all the other migraine symptoms. But these are mainly reversible. But then you have a lot of evidence that at least severely affected patients like chronic migraine, medication overuse with psychiatric comorbidities, those very heavy patients that we all have in our clinics, might have some persistent symptoms in between attacks.
True.
Okay, this can also happen. This, as far as we know, is also potentially reversible if we can reverse the headache to an episodic pattern or control the situation. So, as far as we have information now, there's no really increased risk of dementia or persisting cognitive changes throughout life or at the later stages on migraine patients. Of course, there's an increased risk of stroke, and if you have small vessel strokes or strategic strokes that impair cognition, you will
lose, or you will be, your cognition will be affected.
Yeah, but not because of migraine itself. Okay, and that's the big picture here. So what you can tell patients is you won't get demented for having migraine, but it's important to control your headache frequency. It's important to control all the comorbidities that are coming together with migraine, because this will impact your performance in between attacks. Okay?
Yes.
During attacks, it's part of the syndrome, and we actually need to work on better drugs to control this, because there's no actual treatment for cognitive dysfunction. And we know from patients that sometimes they take their drugs, they control their pain, they control their nausea, but still they are not able to function. They're persistent brain fog, and they're slow in reacting to stimuli. They have difficulty in talking. So even after controlling the pain, sometimes these symptoms persist, and this contributes to disability of the attack.
Exactly. And when we look at cognition, do we also look at medications that are commonly used in migraine and their effect on cognition? Is this something that you also study?
Well, this is a very nice point, and this is one of the problems of studying this, one of the many problems of studying cognition in migraine. Because we have medications that do affect cognition, like one preventive that's well known, that's topiramate, but also treatments sometimes have some cognitive effects, acute effects, and usually all my studies have been done in patients without medication, so to avoid this bias. Mm-hmm. So I haven't dwelt into the effects of medication yet, because we are trying to understand the process of cognitive changes per se. So we are using mainly episodic migraine patients so that we can have attack-free and attack evaluations, and not chronic migraine patients, because there's too many variables to understand. Still, in this very simple group, it's still complicated, and cognitive evaluation is has a lot of bias, like learning effects, like age effects, like education effects. It's not easy.
If you're going to give advice to young researchers who want to go into cognition and migraine, where would they start? Like, what is the best starting point for someone who wants to go into cognition?
Well, I would say have a good idea, a simple one and a good one, and then pursue that. And then the next question will be harder than the first one, and the next will be harder than the second one, and you'll get there.
And in terms of centers of research, I am fascinated by Lion. Can you tell us a little bit about what Lion is? It's something that you've started, and it's very, very inspiring. Can you tell us a little bit about Lion?
Well, Lion is a research group, a clinical research group that was born inside the institution where I work That's Hospital da Luz in Lisbon. So Hospital da Luz is a part of a big private group. It's the biggest hospital of the group. Ever since it started, and I worked there from the very beginning as it opened, we've been developing research groups in several areas like neurology, oncology, there's some cardiology. These are the main areas that we do research. And at some point, we needed a structure and funding to build up better research projects. And that was the birth of LION. It's one of the groups in the hospital that devotes itself to neurology and neuroimaging. And so we've moved on to do cognitive research with neuroimaging and functional MRI and multimodal MRI with EEG coupling and so forth. So that's what we're doing in the last 2 or 3 years. LION was born in 2020, so it was it was very severely impacted at birth, but it's now starting to produce some results. So we'll have some new data shortly.
And funding, where does funding come for LION?
From the hospital
From
itself.
the hospital itself.
Yes.
How big is the hospital? I know it's all over Portugal, but
it's
how
a big
big
group.
is the group?
The hospital itself has 400 beds, so it's a very big hospital for our country. It's the biggest private hospital, and the group is very strong in the country, and it's one of the main private groups in Portugal. Of course, in Portugal we have the national health system that's, of course, bigger and has a lot of universities. But now our hospital has also an university where I'm teaching now. It's the Catholic University associated with the hospital. So again, I came back to teaching.
We need more of you in teaching because we need you with patients, we need you with research, and we need you also to bring the new generation. If we look at migraine care in Portugal, what has changed? How has it changed from when you started practicing to today? What changes have you seen?
Well, I think one of the things that changed for the better, for the much better, is that GP education has been more fruitful. So we have now a new generation of GPs that are more interested in headache and do better care for headache patients. I've been in the headache field for a few years. I'm not going to tell you how many. But actually in Portugal, I think we are a small country, but we have a very active group, and we have a very strong genetic group that studies genetic in the north, in Porto, and that's been very active in the last years. And another group in Coimbra, and us, 2 groups in Lisbon. So we've been working, and I think the interest is growing. Of course, with the new medications, there's a lot of interest also in young neurologists and young researchers, and now other specialties like pharmacologists, health policymakers, and so forth are coming into research also. So I think we're growing, and we will be well represented in this field in the next few years, because the young generation is very promising and very interested.
I think so. All over the world, we're seeing more people are interested in migraine. I think you have also led the way in Portugal. You've also led the way for women. Do you feel there are more women now? Because when I attended conferences years ago, you would go, the panel is all men, but today in IHS you are presenting, we see a lot of women. How has it changed for women, you think?
I think, of course, mainly international. I didn't feel that pressure in my country. I actually never felt the pressure of being women or having children or having to couple the career. Well, I do everything now. I am a mother.
super, we know.
I do research, I do clinics, and I didn't feel that none of that has ever, being a woman has
not affected you.
It has not been a disadvantage. I think it's an advantage, because we multitask a lot. So it's, yeah. But I didn't ever feel that pressure nationally. So, but internationally, of course, I think there was a higher or lower percentage of women leading research in the headache field, and this has been clearly changing over the years. So I think we'll see a lot of women, more women, as time goes by, and men, and everybody that's interested. We're very inclusive.
Exactly, and in the IHC in Seoul here, when you go into the meeting room, you see people from all over the world.
Yeah, it's wonderful.
Like everybody, you see diversity.
Yeah.
You don't see one group more than the others, and
Yeah.
that is always positive for.
And I think in this field, it's quite open. I don't know if other more specialty fields are as open, but I think this is quite open. I never felt a real pressure or discrimination. Luckily, maybe I was lucky.
I think you're also very, very. I'm gonna say you're fit. You do, as you said, you multitask. You do everything perfectly. So that does make life also. It enables you to move forward with career. For young researchers, again, we have people who are going to be seeing this from all over the world. What collaboration do you do around the world, or is your work only in Portugal?
For now, my group is 90%, 95% in Portugal, okay? Because I don't still have the resources to expand. But I will, as I told you, I just moved to another university, so I will start a headache lab there. I'm starting now, so we will start international collaborative projects in the next few years. So hopefully I could see some of you there with us.
Thank you very much. It's been great having you. I'm looking forward to your session. Cognition, as I said, is a question I get almost every day,
Yeah.
and it's a really amazing work that you have done. And when I visited Portugal, they told me, if you wanna know migraine, then you need to know Dr. Raquel. It's such a pleasure and an honor to have you here with us today. Thank you very much for your time.
Thank you, Heba, but you're too kind.
Thank you. Thank you very much.